Hi guys, hope everyone had a good weekend. This is going to be part 3 of my constipation video. The rest of my videos so part 1 and part 2 I released over the last few weeks. So if you haven't seen those, I would suggest watching those first. And you can find those on my YouTube channel, Little Village Pediatrics. Just put that into the search. Or you can find them on the Instagram, Facebook pages too. They will be there. So this next video, I'm going into how to treat constipation a little bit. I'm going to briefly glaze over it, what we like to use, the different phases, and then I'm also going to record this in 2 segments because I don't want it to get too long where people can't watch the whole thing. So first segment now, I'm going to record the other segment right after, and I'll release it just later this week. So then you can watch it sequentially. So basically, how do we treat constipation now? Now that we have the problem, we know what causes it. We have 2 phases we have to focus on. So number 1 is the clean out phase. And the goal of the clean out phase is to empty the entire bowel of stool. So how long this takes really depends on the amount of stool and what's retained in the colon, and it typically always requires some kind of medication. This clean out phase, we really can't do without some kind of medication. The maintenance phase, now that is the goal of this is to maintain an empty bowel by having 1 to 2 soft poops per day, and this often can require medication, but sometimes we can do just diet stuff as well, and that's something to talk with your doctor about too once we get to that point. So the medications that we often use with constipation that your pediatrician might talk to you about, number 1 is osmotic laxative. So this is going to be the most common one is Miralax. You're also going to hear talk about magnesium supplements or something called milk of magnesia, lactulose. Those all kind of fall into the same category. Another one, just like a general stool softener, which is going to be like Docusate, Colace. Those are more of like an over-the-counter pill or tablet that you often hear about. Number 3 would be stimulants. So Senna, X-Lax, those are the pretty common ones you hear. Those can be a little bit more crampy though. So they're not my first choice, not my favorite, because they're causing the intestines to contract. And so you can kind of feel that a little bit more. So not my favorite. Number 4 is enemas. So you're going to see things like Pedialax or Fleet's enema, and those go directly into the rectum to help soften if you have like a really big ball of poop there that needs to get out. Sometimes we have to soften what's really sitting there so it's okay for the child to pass. Out of all the ones I listed above, Miralax is my favorite. It's found to be the most safe, the most effective, and least likely to be absorbed into the body at all. And there are some that are listed above that might be better for post-surgery or straining. There's going to be different choices, and that's something to have a conversation with your pediatrician about, and they know that your child's history and can really help decide what stool softener or what treatment modality would be best. So stay tuned. I'm going to record the next parts of this, which is going to be more specific on the clean out phase and the maintenance phase, and I'll release those later this week. Okay, bye.